Hi, I'm Jack Cush, Executive Editor of RheumNow.com. I'm coming to you from ACR 17 here in San Diego. It's day one, it's the end of day one, some great presentations. I want to talk about Jeff Curtis's plenary session presentation, which I thought was really important to rheumatologists. In this presentation, Jeff talked about Medicare claims data, where he looked at women who were starting on a bisphosphonate. And they had not been on a bisphosphonate for a year before. They went on a bisphosphonate, were on a bisphosphonate for 3 years, and then they stopped their bisphosphonate. So the issue here is, if you take a drug holiday from a bisphosphonate, what is the fracture risk going forward? And so he actually did this. He showed that there was a sizable number of women, I can't remember the exact percentage, but there was 60,000 women who actually stopped their bisphosphonate, and he counted up the ones who were on one bisphosphonate alone, and that was alendronate, and there was a sizable number, and there were others that were on other bisphosphonates that they might change during the same study period. And what he showed in following these people after they stopped for another 3 years, that the risk of developing a hip fracture was up 40% for those who stopped their bisphosphonate and were off it for 2 years. There was a marginal increase in hip fractures after being off for 3 to 6 months, but the real risk, where it went up sizably, was for those who were off of it for 2 years. When they looked at the same hip fracture risk only for those who were taking Fosamax or alendronate, it was a 20% increased risk after being off of it for 2 or more years. So overall, there was these are surprising data that if you had a prior history of a fracture and you went on a drug holiday, you now had a 200% or a doubling of your risk of subsequent fracture. The overall rates for all major fractures was up, I think, 10% for all patients considered in the study. So this is sort of, I think, sobering data for those patients who want to go off drug, and you're going to need to counsel them that if you go off drug, the benefits of being off may be lost with time, especially if they're going to be off for more than a year, especially if they're off for more than 2 years. So that's it from RheumNow.com. Tune in for more videos. Day 2 is coming. See you then.